Well, there are other health crises happening because of the coronavirus, and many people aren't getting treated for other emergencies because they're afraid they'll be exposed to COVID-19 in the ER.
So joining us now to talk about that is Dr. David Tashman from Keck Medicine of USC to talk about this and much more. Thank you so much for taking the time, Dr. Tashman. We appreciate it.
Thank you. Happy to be here.
So the first question is a little bit broad, might be hard to answer. What is the status of our local emergency rooms right now?
Well, I think thank God we're actually quite ready. Most of our emergency rooms have probably doubled in size, expecting the surge that, thank God, due to this social distancing, really hasn't come to the degree that we were expecting. For instance, our emergency department doubled in capacity from 25 beds up to 56 in expectation of this surge. And so far, again, knock on wood, the social distancing is working and we do have capacity.
So let me ask you a question, Doctor. What policies are emergency rooms adopting now to keep non-COVID-19 patients safe from infection?
So we've really done quite a good job keeping the COVID patients separate from the less likely to have COVID patients. We really treat everybody who comes in the emergency department as a suspicious for COVID. So all patients come in, immediately the first question that they get asked is, do you have cough? Do you have fever? Do you have symptoms that could be consistent with COVID? And if your answer is yes, you're taken to, in our case, a telemedicine area where you'll have a telemedicine evaluation by a physician and determine the severity. And if your answer is no, you're taken to the quote unquote clean emergency department where you're still masked and we're still using contact precautions, but basically that's the lower risk area, and that's where we're taking the patients with the traditional chest pain or ankles or cuts and what have you.
I'm sure you've heard people express concern about going to the emergency room. I've heard that a lot with parents who have children being concerned about it. What is your advice to somebody who maybe isn't sure? Should I go? Should I not go? What do you tell them?
So it really depends on how serious you think the problem is. Obviously, if it's just, I think I might have COVID in the sense that it's just I have a cold or a cough, you should call your doctor. And there's also a myriad of telemedicine services that you can contact now. On the other hand, and what I'm really concerned about are the serious cases, for instance, chest pain or sudden weakness or inability to speak, symptoms of a heart attack, symptoms of a stroke. And that those really shouldn't wait, not even a minute. And you really should call 911 or make your way to the emergency department right away. And we're still fully operational for non-COVID emergencies and ready to take care of them.
And Doctor, early on we were seeing so many stories of these emergency rooms really being taxed, doctors and nurses taking to the limit. Have things settled down now for these medical teams that are working so hard during this time?
So initially, of course, it was an unexpected shock to our system to get ready for this surge. But now I think things have settled down in a lot of the hot spots such as New York or New Orleans or Chicago, where things are kind of a lot more intense than we're blessed to have them in Los Angeles. It's still that situation. However, in Los Angeles, because of the social distancing that we were a little bit ahead of the curve we've managed to keep enough of capacity, and we're doing okay.
That is great news. All right. Thank you so much, Dr. Tashman, for joining us this afternoon.
Thank you for having me.